So you could have had a simpler, less ambitious, less troubled plan than the NHS. You could have had the American plan. You could have been spending 17% of your GDP to make health care unaffordable as a human right, instead of spending 9% and guaranteeing it as a human right. You could have kept your system in fragments and encouraged supply-driven demand, instead of making tough choices and planning supply. You could have made hospitals and specialists, not general practice, your mainstay. You could have obscured, you could have obliterated accountability, or left it to the invisible hand of the market, instead of holding your politicians ultimately accountable for getting the NHS sorted. You could have let an unaccountable system play out in the darkness of private enterprise, instead of accepting that a politically accountable system must act in the harsh and admittedly sometimes very unfair daylight of the press, public debate, and political campaigning. You could have had a monstrous insurance industry of claims and rules and paper pushing, instead of using your tax base to provide a single route of finance. You could have protected the wealthy and the well, instead of recognizing that sick people tend to be poorer and that poor people tend to be sicker, and that any health care funding plan that is just, equitable, civilized, and humane must redistribute wealth from the richer among us to the poorer and the less fortunate. Excellent health care is by definition redistributional. Britain, you chose well.